Have you ever felt this feeling of uneasiness after just after finishing restoration on a tooth that you normally would extract, but today, for a reason you don't know, you decided not to extract it? You're in the right place. I'm Dr. Mihai Herlea, and in this video I will show you a technique a technique inspired from 3D printing. It works exactly like 3D printing. A technique to boost your predictability in your adhesive cases. Mainly this technique is composed of 3 pillars. The first 2 are the usual, but the third is the most important, is the subject of this video. So first one is a good isolation, second one is a good adhesion, and the third and the most important is the layering of the composites. Let's take each one of those while watching restoration, a deep margin elevation case of central incisor that will be part of a bigger restoration, a full mouth restoration, a full bridge as we call it around here. So the first one, the isolation in this case, for the placing of the rubber dam, I had to remove some of the gingiva and even some of the bone. I just used simple tools like a Fisher burn, a high speed, and plenty of irrigation. You don't need anything else, really. So you heard me right, just to clear the way for placing the clamp. That's the only reason I did the gingivectomy and osteoplasty. After the gingivectomy and the osteoplasty, I placed the butterfly clamp and together with the rubber dam, my technique of choice in these cases. And the most important material, a roll of PTFE, tucked in between the rubber dam and the remaining two structure to create some supplementary isolation. So the next step, after making sure that your isolation is the best as you can get, it doesn't have to be perfect. You will see later. It has to hold for some seconds the blood coming from the tissues below. I will explain this with another occasion, but let's keep it simple for now. I did place next step is enhancing adhesion. How do I enhance the adhesion of this old dentin that had a post there for 20 years? It had been exposed in the oral cavity, so it's not the very best dentin that you can find. The secret, I always sandblast. I know everybody does it, but in my protocol it became like a law. It's like a constitution of the state. You never do an adhesive case without sandblasting. So this makes 3 things. First of all, the sandblasting cleans the surface like nothing else does. It cleans it in such a way that you can see even the tiniest spot where the dentin needs more preparation, more some bad dentin, some that it's not hard enough to hold, to keep the bonding during the bonding process. You can see that those areas after sandblasting, they become very, very evident, and you can further clean them. Second, it creates no, this that was the second with the dentin exposed, the areas that need further cleaning. Third is you create macro retention like in any material. So I believe it changes the texture, and you create more surface for your bonding later. So next is, after that, it's a normal bonding protocol. I always use a 2-component adhesive. It's no secret, it's OptiBond FL. In my hands, it's the best adhesive ever because of its micro filling. It's practically a very, very liquid composite. So now this was the adhesion step. We'll move on to the composite layering, which is, I said, I promised you, will be the heart of this technique, the heart of enhancing your adhesive cases. So it's no big deal. You have to have in mind that your restoration will always fail. If it ever fails, will always fail from the margin to the center. Will always do like this. It will never fail from the center to the margin. So the objective of this kind of layering is to secure the first layers of the composite at the margin of the restoration, as close to the margin as possible, and to be sure that those 4 first layers are very, very well bonded to your tooth structure, so you don't have any tension remaining there. Normally, after sandblasting and making your adhesive protocol with bonding and archid etching and bonding, you would go with the post, but I propose this way around. You build like 3D printing, layer by layer. You light cure, place another layer, light cure, place another layer, and in this way you build the first 2 millimeters, sometimes more, of the tooth reconstruction in a way that is free from tension, and free from tension is in the most important place where your restoration meets the remaining tooth structure. So let's move on. After I do this 2 to 3 millimeters of reconstruction, it's like a tube. It has this entrance to the canal for the post. Now the post becomes of secondary importance. It doesn't need to hold everything together. As recent studies say, that the post being in the middle of the tooth doesn't have much influence at the margin of the tooth. It's like in construction, where the reinforcements in concrete have to be the closest to the surface of tension. So if you have tension of the outside of the tooth, which normally you will normally have during chewing, you will have to place something outside, not inside the tooth. So the post only has the role of keeping things pressed in. I don't know how to say it, like keeping them on the long axis of the tooth, not to come apart. It's the only way your post will have any action. So after cementing the post with by a dual cure cement, which I always do in this fashion. I know it's old-fashioned, but in my hands works well. You can also place the dual curing cement directly in the canal using auto mix system. But I'm on, as you may know, I'm an older dentist, so I learned another way back in those days. So the old habits die hard. Next, you have to, after removing the rubber dam and you have the restoration shaped, gross shaped like you want. Normally you don't see the neighboring teeth, and you have to over contour because you don't have the axis of the next restoration, especially if it's a multiple unit bridge. Like in my case, it will be a full bridge, so it has to be parallel to the other abutments. I usually over contour this part. Some deers. I don't know if you can see them. This is a usual morning in my small town, in the forest near the town. So let's move on. The preparation must be done in this stage because of the overhangs that you have over the margins of the restoration. You always, when you place the first layers, and in any technique, when you place the post, like most producers recommend, you have composite overhang over the tooth, remaining tooth structure, and it's very, very important to remove those. So when you come with the final restoration, you have a smooth passage, smooth surface coming from the root to your reconstruction. Because we always use verti-prep techniques for preparing these teeth. I never use a chamfer or a, how do I call it, a step between the next crown and this reconstruction. So in this phase you have to prepare with a fisher burr, very, very careful not to damage the remaining tooth structure and not to go too deep in the composite, which at this stage is normally not hardened at 100%. It's a little bit soft in this stage, so it's very, very easy to go inside it with your burr. So you can see in this image, which was taken during it's not a photograph, it's a crop from the another video that I did when was the delivery of the final prosthesis. So it's been in function, this abutment, it's been in function for 6 months with the provisional restoration. So you can see, as I know this image is not the best one, but you can see how the gingiva healed and how the restoration goes beneath the gingiva, and this is no problem. So I know this has no ferrule effect. I know this this is extreme, but I do this kind of reconstructions from, I know, maybe 12 years. I have 12 years now of experience with this kind of restoration, and I only had failures in single restoration, single tooth restoration. So it's this kind of bonding. I really believe in this kind of bonding, in and the toughness of this connection between my restoration and the remaining tooth structure. So there are many factors you may have taken in consideration. It's occlusion of the patient, your relationship to the patient. Usually I started doing this to my friends, because if you have a friend or maybe your son in your dental chair, maybe you don't want to extract, maybe you want to keep a tooth, even if you keep it for 5 years more and place the implant 5 years later, because I like to place implants, but implants have their problems. So I try to postpone as much as possible the placing of an implant. So if you like this video, please hit subscribe for more out of the box dentistry, where I push the limits and you can watch. Thank you for watching.